Novocure conducted its first phase 3 randomized trial in patients with recurrent GBM. So these are patients who had received surgery, high-dose radiation to the head, and first-line chemotherapy, and then had failed, and their tumors had grown back. We divided the patients into 2 groups. The first group received second-line chemotherapy, which is expected to double the life expectancy versus no treatment at all. And then the second group received only tumor-treating field therapy. What we saw in that trial is that the life expectancies of both groups, so the chemotherapy-treated group and the tumor-treating field group, was the same. But importantly, the tumor-treating field group suffered none of the side effects typical of chemotherapy patients. They had no pain, suffered none of the infections, they had no nausea, diarrhea, constipation, fatigue that would be expected. Based on this trial, in April of this year, the FDA approved tumor-treating fields for the treatment of patients with recurrent GBM. Importantly, it was the first time ever that the FDA included in their approval of an oncology treatment a quality of life claim. So I'm going to show you now one of the patients from this trial. Robert Dilbundi was a famous Swiss cycling champion. He won the gold medal in Moscow in the 4,000-meter pursuit. And 5 years ago, Robert was diagnosed with GBM. He received the standard treatments. He received surgery, he received high-dose radiation to the head, and he received first-line chemotherapy. A year after this treatment, and in fact, this is his baseline MRI, you can see that the black regions in the upper right quadrant are the areas where he had surgery. And a year after that treatment, his tumor grew back with a vengeance. That cloudy white mass that you see is the recurrence of the tumor. At this point, he was told by his doctors that he had about 3 months to live. He entered our trial, and here we can see him getting the therapy. First of all, these electrodes are non-invasive. They're attached to the skin in the area of the tumor. Here you can see that a technician is placing them. They're much like bandages. The patients learn to do this themselves. And then the patients can undergo all the activities of their daily life. There's none of the tiredness. There's none of what's called the chemo head. There's no sensation. It doesn't interfere with computers or electrical equipment, and the therapy is delivered continuously at home without having to go into the hospital either periodically or continually. These are Robert's MRIs, again, under only TT field treatment. This is a therapy that takes time to work, okay? It's a medical device. It works when it's on. But what we can see is by month 6, the tumor has responded, and it's begun to melt away. It's still there. By month 12, we can argue whether there's a little bit of material around the edges, but it's essentially completely gone. It's now 5 years since Robert's diagnosis, and he's alive, but importantly, he's healthy, and he's at work. I'm going to let him, in this very short clip, describe his impressions of the therapy in his own words.
Ma qualité de vie, je la qualifierais aujourd'hui d'une manière un peu différente de ce que les gens pensent. Je suis le plus heureux du monde, l'homme le plus heureux du monde, et je déguste tous les matins la vie. Je m'endors tous les soirs très très bien. Et je suis, comme je répète, le plus heureux des hommes au monde. Le matin quand je me réveille, j'ai dit merci, je vis.
Novocure is also working on lung cancer as the second target. We've run a phase 2 trial in Switzerland on, again, recurrent patients who have received standard therapy and whose cancer has come back. I'm going to show you another clip of a woman named Lydia. Lydia is a 66-year-old farmer in Switzerland. She was diagnosed with lung cancer 5 years ago. She underwent 4 different regimes of chemotherapy over 2 years, none of which had an effect. Her cancer continued to grow. 3 years ago, she entered the Novacure lung cancer trial. You can see in her case, she's wearing her transducer arrays, one on the front of her chest, one in the back, and then the second pair side to side over the liver. You can see the tumor treating field generator, but importantly, you can also see that she is living her life. She's managing her farm, she's interacting with her kids and her grandkids, and when we've talked to her, she said that when she was undergoing chemotherapy, she had to go to the hospital every month for her infusions. Her whole family suffered as her side effect profile came and went. Now she can run all of the activities